I think building loyalty ultimately comes down to trust. And I think the trust comes in the consultation.
We have skin, we have fat, we have muscle, deep fat and bone. If we're only treating the fat pads or the bone with filler, then we're not doing anything for the skin.
The results are important, showing before and afters are really important. But it's not just your work as a niche, it's sort of your brand as a whole.
Hello and welcome back to our podcast, The Aesthetic Edge, where we discuss all things aesthetics. Today we're going to discuss a very important topic, developing your niche, how to set yourself apart from all of the competitors around you. We're also going to discuss client retention. We always focus on client acquisition, but revenue is mostly made from your repeat customers. Today I have Dr. Natasha Murcott who's joining us. Dr. Natasha, thank you for joining me today.
Hi, thank you for having me.
Tell us a little bit about yourself, Natasha.
So I'm a dentist by trade, but I stopped doing dentistry in 2020. I started doing aesthetics the same year I graduated in 2016, and then I became a trainer for Derma Medical in 2018. I've set my own clinics in London and Birmingham, and soon to be Bath, and I also work for a plastic surgery clinic at the moment. I've worked in High Street for other clinics across the UK. And I think developing your niche is one of the hardest things to do when you're starting out.
Yeah.
You're a beginner, and I think with anything, you're thinking, well, how am I going to make myself special? And when you're starting out, you don't necessarily feel special.
Yeah, absolutely. I think everyone goes through that kind of struggle, don't they? But let's take it right back. So you just done dentistry, and forgive me being a silly doctor, but I always thought dentists were always the smartest doctors, because traditionally you think that they go into a field that's mostly private, they get paid a lot more, and the stress is substantially less. So tell me, why did you make the decision to go from dentistry into aesthetics?
I think I always wanted to do it. It wasn't necessarily a decision as such. I think I kind of went into dentistry originally with the thoughts of being a cosmetic dentist and doing the artistry, because I did a lot of art when I was at school. So I've always found that side interesting, so the art and the science. And as soon as someone mentioned that you could do, I think it's Master Botox that came up in one of the lectures. As soon as someone said you can do Botox as a dentist, I knew I was going to do it. So as soon as I could afford the course, I booked it.
Excellent. And since then, you've obviously grown your clinic. Tell me, what are some of the most important lessons that you learned along the way in building your own individual clinic?
Oh, gosh, so many. The most important lessons, I think probably confidence. I think, and especially with students that come, you can be very competent, but the confidence doesn't quite match it. And I think it takes a long time for your confidence to match your competence. And you end up having this sort of balance where sometimes you might feel a little bit overly confident and then you might have a minor complication that kind of brings you down a peg. So I think it's probably, you've just got to trust yourself, make sure you're always trying to learn, you're doing your best, and evaluate your work. And sometimes your confidence levels are going to change. Sometimes you have a bad week. And it's just, you've got to back yourself, back your training, and keep going. Yeah,
absolutely. I remember when I first got started, it's incredibly nerve-wracking to go out there and treat your first patient. But we always say, Natasha, don't we, to all of our students, it's the students who go out there and see patients right away, they're the ones who will always do well, because you have to do it. Are you going to feel more confident the day after your course or 3 months later? Yeah, absolutely.
I think anyone that's watching this podcast and has got any courses booked, get your patient booked in the day after. Get all your insurance as soon as possible, or give yourself time to get your insurance, get your product set up, and then see your patients a week later.
Yeah, of course. So Tash, you're obviously known to create very beautiful, very subtle results for your patients. Obviously, I've taught you everything you know, obviously. It's funny because actually Natasha taught me everything I know. I remember when I first got started at Derma Medical, you were my trainer and you taught me the ropes.
I'm a grandma, I've done that. I'm a great grandma now.
You look beautiful, you're nowhere near a grandma. So in a world of overfilled faces, how do you find your niche? How do you make sure your patients get consistent, natural results?
I think that's a good point, but also it changes a lot. I think when we started, so 2016 for instance, the overfilling was a lot more obvious. It's actually rarer now that I see a pair of lips where I think, oh my goodness. Whereas that was a really frequent occurrence. And all the celebrities last year, they're having their work dissolved, refilled actually. More skin boosters. So the niche has probably changed, and I think natural but noticeable, for instance, or natural enhancement with a gentle touch, for instance, was sort of my tagline. It was quite different back then, whereas I think actually a lot of injectors now are doing a lot more natural work.
Yeah, of course.
So I think my niche has probably changed a little bit, but the morals are the same in that you're still delivering the same results, but it's more of a personal niche. I think like your patients will come to you because they trust something about you. Obviously the results are important, showing before and afters are really important. But it's not just your work as a niche, it's sort of your brand as a whole. So like being trustworthy, being a medical professional, looking after your patients and following up with them. Making sure they're heard, just spending time with them in the consultation, I think.
Makes a huge difference.
Building that relationship. And I think that can then become your niche, which is automatically going to be different to anyone else's.
A lot of clinics sort of focus on a conveyor belt of patients where you have 10 minutes in, see the patient, you have to do your consultation, your treatment, your pictures, your consent forms, and the treatment itself all in 10 minutes. Whereas I think you and I have adopted an approach where I sometimes will spend 45 minutes just having a chat with my patient. 100%. I know for a fact that if I show this patient I care during this 45-minute consultation, that patient will stay with me for the rest of their life or for like decades. And that is so much better as a business setting rather than treating them as a transaction where I'm like, okay, I've done your Botox, off you go. They're going to go and find someone else that actually listens to them.
Exactly. And for you to listen to their red flags. I think it takes a long, like when you're doing your consultation and when you're starting out, give yourself an hour because especially if you've done our skincare course, as soon as you start talking about medical grade, to talk to someone about their skincare routine, their skincare concerns, explain what medical grade products are, the ingredients they need, the skin boosters they need, the Botox, how it works.
Takes a while.
It's nearly taken me 5 minutes just to list that off. But to listen to them properly, it's really difficult. Someone might book in for 3 areas of Botox and actually they'd benefit from a completely different treatment. And if you try and explain that to them in 2 minutes, they're going to go, ooh, not sure about this.
But if you take the time to explain it to them, they realise that you're not just seeing them as a quick transaction. And like I always say, I turn away about maybe 10 or 15% of my patients because I try to tell them that this treatment won't suit you, but have you thought about this instead? I don't just turn them away because that would be a silly business decision, but I bring them towards something that would actually make them look good. And we've developed that aesthetic eye over years. And when they actually have that treatment and they see that they look better, that trust that you get, they'll be with you forever.
Tear trough and cheek filler. I'd say 9 out of 10 tear troughs need cheek filler instead. And I think they might not necessarily know that. But I think you're right. Keep them in-house, but educating them. It's almost re-educating them. Because sometimes they've seen other injectors. And they might have really liked the result, but actually you can deliver a better result. I think that can also be quite hard when you're starting.
Yeah, absolutely. So I found that my niche has changed over the years. When I first got started, my niche was basically all that I could attract, which was 3 areas of Botox, maybe a bit of lip filler here and there.
Botox king.
Botox king. And now that I've been in the industry a little bit longer, for me personally, I've painted a niche of being an expert in terms of the high demand but low supply treatments. So things like non-surgical rhinoplasty, tear troughs, full facial rejuvenation, the more complex things that actually as a business decision is better for me because it's more income per patient, but it's also the more difficult things that other people can't do as well. Is this something that you found in your own clinic as well?
I think so. I think it's also down to chair time. I think when you're starting out, you get really excited. You're like, I finally got a nasolabial person coming in, 1 mil, and you're thinking in terms of 1 mil. But if you have a 60-year-old patient coming in, for instance, they have the budget, they have the time, they'll come on a Tuesday afternoon, but they need more treatments. So if you're giving them a 6 mil treatment plan, someone that's 60, it's actually quite a low dose as such. Like often they might need 20 mil. If you can put them on a long-term treatment plan, they're going to be more loyal. They know it manages their expectations as well.
That 1 mil's not going to change their face.
1 mil is label and a 6-year-old isn't going to cut it. And so it manages their expectations without ever disappointing the patients. So I think most of my patients are probably postmenopausal females, and they really need that multimodality. So they're also really hard to market because everyone's very secretive. And so
never get any referrals from the over 40s.
No, the last of it will only be 1 or 2. Because social media is such a big thing. But I think noses are fantastic for getting on social media. Tear troughs, they really bring people in. So you might have these procedures that I'm doing, which are on social media to bring in more and new patients. But then word of mouth, I think, is best.
It is the best.
For full face transformations.
So with these patients, so you know the typical patient that you have, perimenopausal, postmenopausal, 60, when you tell them like, look, we're going to need to do quite a few things in order to achieve the result they want, most patients I find will just be thinking, oh, this is going to be a lot of money. So how do you explain to them why you need to do multiple different treatments in order for them to actually move forward with the treatment plan?
Perfect. I think I'm quite honest, but then you have to gauge what your patient's sense of humour is like a little bit when in the consultation, because there are some patients who you can be very real with, and you can say, look, in order to give you the effect that I think you're wanting, I would need 20 ml of filler. Okay, and you can say, look, you could pay that to me, or we could have a facelift, and then I can replace your volume after with a smaller quantity. And I know it sounds very drastic. When you're a beginner, you're thinking, I can't say that to someone. But you have to give your patients all the best options.
Absolutely.
If they start paying you £4,000 a year, for instance, that's half their facelift. With some surgeons, I don't know how much the thing must be.
Anywhere between 10 and 20k,
exactly. So you have to give them the best option. I forgot what the question is now, but
it's essentially. But I find something that really helps in that sort of scenario is actually just talking about the science. Like I explained the fact that 1 ml is only a sixth of a teaspoon, and when you put it into that sort of setting, then they understand. Okay, a sixth of a teaspoon is not going to completely transform my face. And I also like to talk about different treatment modalities as well. And the first way I like to say it, and hopefully this will be helpful for the listeners at home, is that I'll say that we have multiple different layers of the face. We have skin, we have fat, we have muscle, deep fat, and bone. If we're only treating the fat pads or the bone with filler, then we're not doing anything for the skin. Therefore, we need to think about skin rejuvenation. We need to think about skin injectables, Profilos, Sunicos, polynucleotides, a good topical skincare regime. And I think if you talk about the science of these sort of treatments, patients trust you more, and they don't just think that you're after their money. And I've had this discussion. I've had feedback from my patients multiple times that they never feel that when you explain the science, they never feel like you're trying to snake them out of some money. Oversell them. Yeah, exactly.
I actually use the analogy of an orange, and I'll say, look, filler is going to plump the inside of the orange. So it's going to plump it up. And then if we think about our skin boosters, that's going to make the rind thicker. And then we need our laser resurfacing, we need our medical grade skincare.
I'm going to nick that off you. That's a good one.
You can use it.
Yeah, that's a good one,
And because you need to work out which one's the most important to your patients, because skin boosters are really popular at the moment. But if you just sell someone a course of Profilo, which when we're starting out, we want to do that. It's a nice, easy treatment. But they're expecting to have volume. Really, their expectations haven't been matched because we should have done their cheek filler first. Filler lasts longer. So if your patient is on a budget, you put them on a filler treatment plan first.
Always.
And then once they've completed their filler, then you can maintain them with your 3-monthly Profilo, your 3-monthly Botox. But if I could, I would delay their treatment by a month to put them on medical grade skincare first. So medical grade, filler, and then maintain with skin boosters.
Using a multimodality approach. I find that when you're using filler, the wonderful thing about filler is that you get instant results, which patients really like. And I think if I see someone for the first time, it's actually rare. This might just be a personal thing. It's actually rare that I will just do skin boosters. I will always, if they're suitable for it, of course, I would prefer to do filler because then they see that instant result. The reality is most patients don't have the patience to wait for the results that come from topical skincare or skin injectables. Having to come in for 3 sessions of polynucleotides, which is quite a painful procedure. You don't want to start them off on that.
Agreed.
Of course, you do have some patients who might be, extremely handsome or beautiful, have full volume in their face, and putting filler in them would be inappropriate. And if that's the case, I just explain that to them. I'll say, don't let anyone put filler in your face. Your facial structure is amazing. Let's focus on the skin booster. So I think it comes back to that age-old saying that consultation is key. Everyone is individual. Everyone needs an individual consultation to find out what suits their face. And it's about building that aesthetic eye, isn't it?
And timeline and budget. I think it's okay to ask your patients stuff like, do you have any events coming
We're
up?
scared about talking about money though, aren't we?
We're scared. And sometimes I'll say, okay, look, did you have a budget in mind? And some people might come in and say, look, I've got a budget of £100 medical grade skincare. Okay. I've got 300. Okay, let's do 1 ml of filler now, 1 ml in 3 months, and then you're building up. You're seeing it as building blocks. I've had one person say, my husband's been on 3 ski trips this year. Okay, fine. So we can do the filler, we can do some laser resurfacing, and we can do the skin boosters in a short time period. And it helps you understand where your patients are at.
It takes time to build that kind of confidence though. When I first got started, I would always feel nervous. I don't know anything about my patient's budget, right? But in my head, £2,000 sounds like a lot of money. So I would somehow just almost edge my patient away from doing those treatments. So, well, let's just take it slowly. But if that's what the patient wants and they want that dramatic outcome, you should be proud and you should know your skill set that you can deliver those results if the patient has the budget to do so. Everyone wins in that scenario.
I think also as professionals, but I've had it with staff members as well, I think we tend to see the value things based on our budget. And ideally, you actually want a patient that's got a big budget than you do almost. They're the ideal patients that can come and afford things. So we're not seeing the value in how much something is based on what we can afford. It's what we're able to deliver, why we're better, but also what patients you want to attract. And that comes down to staff training as well, because I think often when we're thinking about the staff that we might be hiring in clinic, that would be a lot of money for them. So it's about educating them on why this is that price, why it's good value. And I think that can also be quite hard when you're trying to build up your brand.
It's something that comes with time, isn't it? And that's something that I've had to move through as I move through my career. I suppose the team that you hire has to just be in that sort of caliber and willing to accept that sort of teaching. So in terms of someone new who's new into the aesthetic field, who's trying to develop their niche, what sort of advice would you have for them in terms of growing their niche or even identifying their niche in the first place?
I'd say just chill out. It'll come. It'll come. Your first client, for instance, mine was my mum. Who was yours?
My dad.
Yeah.
He did not want it. He did not want nasal label filler. He looked amazing afterwards, and now he comes to me every year.
But you had informed consent, right?
Yeah. Loosely.
It's probably going to be friends and family. And then you get into the realms of 6 months later, people know you're not a brand new injector. Their friends and family come. And it expands. So your first, probably up to 100 patients are going to sort of loosely know you, or you've treated someone that they know. So they're automatically going to trust you. And there'll be a reason for that. And that's kind of your niche when you're starting out. Obviously, you're a medical professional, so you're going to be safe. You've been trained, hopefully you've been trained by Derma Medical. So you can say why that's better. For instance, your work is going to be safe. It's not going to be overfilled. Start low, go slow. You can always add more. You can't take it out. And whatever you're enjoying, I think start with the procedure you found the easiest, and then whichever one you enjoy the most, you'll do. But whatever you're putting on your social media,
that's what you're going to bring
in. So that can be your niche. But it's okay for your niche to change based on what you're enjoying, what you're learning on. You might not know how to do temple now. You might decide you want to be the temple king, and it can change, for instance.
So that's actually really good advice. I think too often we're like, okay, I need to be the expert at full facial rejuvenation, but if all of your patients are only coming in for 1 ml filler, that's not going to happen. So I think a really good thing to extract from that is being realistic about your niche at that particular time and allowing it to change and not putting too much importance upon it, at least when you're first getting started. So we said that we're going to talk a little bit about client retention. Now, client acquisition is always good. We always want new patients coming to our clinic because your existing patients might move to another country, whatever. They might not always stay with you. But I believe client retention is even more important. So what are some of the characteristics, what are some of the strategies that you put in place in your clinic to help develop client retention?
I think building loyalty ultimately comes down to trust. And I think the trust comes in the consultation, but also the aftercare. So I think it's making sure that you're contactable, even if it's something as tiny as a bruise. And now ideally, we always want to try and preempt the complication. We want to over-egg what could happen so that when it does happen, because bruises will happen, lumps and bumps will happen, that your patients don't panic. And I think we always say, I don't want you to ever be pondering on anything for 10 hours, worrying if it's normal, when you could very easily contact me and I could reassure you within 10 minutes or so. So I think it's making sure that you're there for your patient. Complications can happen. Some of my most loyal patients I've had complications with, and I've been contactable, I've seen them, and I've held the hand, reassured them whenever possible. So I think that's probably the best way to build and maintain, for instance.
That's great, but just to play devil's advocate for a second, sometimes if you are too contactable, that can also be a bit of an issue. I don't know if you found this as well. I think we both recently hired personal assistants who can actually act like a bit of a barrier. But I think the wonderful thing about those guys is that they can identify what needs to be communicated to you directly, straight away, and what can be paused and what they can even communicate back to the patient.
And time frames, I think, as well. So if you are wanting to have a day off, then
God forbid.
Then they're trained on what is an emergency. I had one recently where we did the vascular occlusion protocol, for instance. Like if you ever hear anything like pale, colour changes, pain, you let me know urgently. bless them, they've never had to contact me on it sometime, but I had the message. Someone's come in, they've got a blue discoloration, and I'm thinking, okay, well, blue is probably not under eye. Filler done 2 years ago.
Okay, fine. Okay, yeah. Sometimes it can be warrant.
They action, but I'd rather them bother me for that
100%.
aspect. But I think you're right. You don't want to be contacted about a bruise. But if someone is, I know it can be annoying. You might not want to be replying to that message now, but I think the sooner you can reassure them, it doesn't take too long, then you can nip it.
And that patient's going through a lot of anxiety. For you, it's a quick message saying, that's absolutely fine, nothing to worry about, a voice note that takes literally 5 seconds, versus a patient whose anxiety is only growing because they're like, oh, Dr. Nurse, Natasha said blue and pain is a bad thing, but blue and pain is also a bruise.
Yeah, a bruise. Different types of pain, for instance, and with students as well. I heard that actually last week, had any pain, let me know. It's not any pain, it's pain that's getting worse. It's normal to have X, Y, Z, but there are some patients that are always going to be a little bit anxious, generally first timers, anxious disposition, and no matter how much I explain this to you, I've given you your written aftercare, I know I'm going to get a message the next day.
Of course.
But
hand-holding is like 70% of what we do. Yeah.
Exactly. So I think it's just, you've got to treat patients like you would want you or your mum to be treated. Yeah. Would be
that's
my
really
sort of
advice.
setting standards.
Yeah, just kindness.
And train someone to filter.
Yeah, exactly. And I couldn't recommend that highly enough, actually, because getting all of those messages, because they'll even message you for things like booking an appointment.
Yes.
And actually, this is something you taught me, Tash, is that personal assistants, they don't bill you, they're not working 9 to 5. They only bill you for the time that they're working in your clinic. So they're probably working with multiple different people in their own clinic, but they might reply to a message, and that might take 30 seconds of that time. And that is only what the PA is going to bill you for. And that's not something that's actually commonly known. I thought I'd have to pay someone a huge salary.
Yeah, you don't need to be
but it doesn't need to be like
staff.
that. Yeah, and also I think having that little separation creates a sense of professionalism as well. That this is a professional doctor that you're dealing with, dentist, whatever, and you shouldn't be too contactable. But if there is a complication, you should be.
Yes, I think it's that fine. When you're starting out, it's difficult, but also when you're starting out, you might be so excited. The requests, can you treat me at midnight on a Tuesday night? Obviously, no, I can't, but I really want to because you're my first paying patient, and it's harder to set your work-life balance. And I think that's the biggest thing that when I hired, I don't know how long I've had my assistant for now, 4 years, maybe. It just helps ring fence your personal life. I think you don't need to be on your phone. You feel like you should be. You don't need to be on it all the time. You know that someone will call you if there is an issue. And
that's the thing about growing a business, though, isn't it? Because obviously my stress levels are significantly less than when I was working in hospital, when I had patients' lives on my hand. But the thing is, when I went home, I was at home. I could relax, I could de-stress. I find that when you run your own business, particularly in aesthetics, you always feel this sort of guilt that you should be doing something to grow your business, or when a patient messages you if you don't have a PA, you want to message back straight away because you don't want to lose them. And I find that work-life balance, even though it's significantly better, there is that aspect that not many people talk about, that actually, it can be quite difficult to maintain those personal boundaries that you set. But creating those boundaries in the first place will often protect you in your moments of, you want to spend time with your kid, you want to spend time with your friends, enjoy a drink. Having that sort of separation, I think, really works. So in terms of... I always find that aesthetics is but it's equal parts listening and injecting. So it's really about understanding what the patient wants. What are some of the techniques that you've incorporated in your consultation to make sure that your patients feel that they're listened to, that they're heard, that they're understood?
Okay. I think firstly, again, start with the orange, for instance. I always start with the outer layer, and I'll say, okay, so what's your current skincare routine? And then they can say, and then I'll say, okay, how does your skin feel? How does your skin look? How do you want your skin to feel? How do you want your skin to look? And having those sort of very specific questions, I think, makes it easier for them to understand what it is. And then repeating back to them what they've heard, just to make sure that you have so what I'm hearing is that you're thinking you want a nice natural slight glow up, nothing too drastic. You still want to look like yourself, but maybe feel a bit more refreshed. Or are you looking for that slight more enhancement? Or how much an improvement are you wanting to see? I think you're listening, but you almost want to try and guide them with questions, because we have all this qualitative information, which can be very difficult to turn into aesthetic angles.
Yes, of course.
And so you're really trying to listen to what they're saying qualitatively, but then if there are any questions that you can do to get more black and white answers, like that, just to make sure that they know that you've heard, but you're also making sure that they're matching what you want to do.
Yeah. Yeah, no, that makes sense. Yeah, perfect. So in terms of when you're trying to grow your clinic and you have a patient coming into your clinic and you've done the consultation, what are some of the treatments or practical things that you do to try and, for example, make the treatment a little bit more comfortable for the patient? So when the patient comes to you, they know they're going to get a particular type of service. Is there anything you do to reduce pain or anything you do to make sure they get a particularly good aesthetic result?
Yeah. I think relaxing your patient beforehand, making sure that they're comfortable. If I have an anxious patient or if someone's had a bad experience before, I won't treat them on the same day as their consultation.
Yes.
I'll say, look, come meet me. We'll have a talk through.
Yeah.
And we'll talk through all the risks. You can go and have a think about it. And then if they are really nervous, you can say, look, I'll give you a call the day before your next treatment. We can talk you through exactly, just to kind of remind them. And I think it's just making sure that they know that they're in a safe space. They're in control. If they want me to stop, I will stop. And it's really basic techniques. For instance, we're just saying, look, you want a squeezy ball, and you can say, okay, if you want me to stop, pop your hand up. Okay, I will stop straight away. But talking to them throughout. My Brummie accent tends to come out a little bit when I'm injecting as well, so I sort of end up sort of singing to people a little bit. I'll say, okay, like,
I've noticed that when you teach.
Breaths.
Of course,
And it's just I'm counting them down as well. So say you're going to feel a slight scratch. Really stretch the skin, because also I think we're quite nervous about touching people when we start out, but like hoik that skin back.
Yeah, it makes a difference putting tension on it. Yeah.
But it also makes the patient feel a bit more secure. They know that, because I think sometimes they think, I can't breathe, I can't swallow, they don't want to move, they don't want to talk. Telling them, look, like you're free to move a little bit. Don't worry about staying rigid. Keep breathing. The number of people that hold their breaths for injections, the number of students that hold their breaths when they're injecting. And then count them down. So especially like Profilo, for instance, I'll actually say, nearly there, 3, 2, 1, you're done.
Yeah.
And you're giving them something to think about.
Yeah, wonderful. Those are all really helpful tips.
Toes.
Yeah, wiggly toes. A couple of things that I like to do in my private clinic to really try and make things as comfortable as possible for my patients include things like using a 30 gauge needle as opposed to using a 27 gauge needle. In terms of having a 27 and a 30 gauge needle in my face, I can tell you it's significantly more comfortable having a 30 gauge. A smaller needle also means less inflammation, less swelling, less bruising, also less chance of a vascular occlusion as well.
True. To play devil's advocate, if you're a beginner and you're trying to get a 4 through a 30 gauge, I think we run the risk of shaking and moving off the point. Personally,
I agree with you, but a recent discovery for me is that I've started using the TSK 30 gauge needles. If you try to use just the standard Botox 30 gauge needles, they're far too small. I know 30 gauges are the same size, but the difference is that the TSK they're the same size, but the TSK is ultra thin walled, which means that the diameter of the hole is actually larger. So it's actually not difficult at all. I've actually taught quite a few students starting off using a thick filler, but using these TSK needles, and it's significantly nicer for the patients, and it's much easier to push through. So that really helps. I think reassuring the patient that the numbing cream that you're using is really good. So for example, we like to use Numb Skin at Derma Medical, which is 10% lidocaine rather than 4%, 2.5 times stronger. So when you say all these little things like, look, I'm going to use a very small needle, much smaller than what other doctors use. I might even give you numbing injections beforehand for the Profilo. I might use a very strong numbing cream. I think all of these things make it a lot more comfortable for our patients. Lovely. Well, I think I've taken up enough of your time, Natasha. Thank you so much for joining me. As always, I learned so much from you. Guys, I hope that this was useful for you. I hope you've learned a lot in terms of building up your clientele, in terms of client retention, and also building your niche. Hopefully you've learned a lot, and we can't wait to see you on the next episode. Thanks so much for joining, and we'll see you next time.